Hello, everyone. I'm Doug Bletcher, the host of the Autism Stories podcast. A lot of autistic people I've met have chosen to pursue careers where they can help others. These five podcast guests are all practitioners in a healthcare profession, such as speech language pathology, physical therapy, or occupational therapy. And each of them is taking a neurodiversity affirming approach to their field. I've enjoyed learning so much about the different strategies that they can use to support their autistic clients. Here are some clips from their interviews so you can hear how each person is pushing for more inclusive practices in their healthcare career.
Learning how to suppress a reaction. Like I've seen some people not want the individual to cover their ears when there's a loud noise, or, to make eye contact when it might be painful for them. This impacts them in such a, not just a psychological way because they're trying to change who they are as an individual, but it also teaches the individual to ignore their pain receptors and ignore their interoceptive state of being, and not to listen to their body signals, which can actually teach the individual not to know how to regulate themselves. Our natural reaction is to always protect ourselves. And when you are taught to ignore your own natural reactions and your body's always in a fight or flight response. I also work with mostly individuals with significant sensory needs. And that could be modifying the environment where every one of our classes has a movement and sensory area and swing and calming area. We have dividers to block up and structure the class so that it doesn't become as overwhelming for them. As well as we teach all the classroom staff and aide to teach the individuals how to advocate for the sensory needs that they may need and have, a choice board with those options available to them.
I had a child recently. I shouldn't have used the word calm, but I did. And they got mad at me when I said that I'm doing what makes me feel calm. And they got mad at me because I wasn't doing it the right way, that their school has been teaching them to be calm. I'm kind of telling you all these scenarios that could happen upon well-intentioned but really careless use of just trying to label how autistic people feel or get students or children or autistic people into a different emotional state, which may not be the one that they're actually at. I can easily take that same client who's 10 and is using some mouth words to communicate and really like Sesame Street. And no, I'm not going to take Sesame Street and use that as a prize within therapy. I'm not into Sesame Street, but I love the passion that the student has. And so using that as a grounds for connection, for bringing more autistic joy, for exploring many ways that the student can communicate regarding Sesame Street. But I guess to put it all together, it means valuing autistic strength through a thorough understanding of the autistic experience.
Maybe this autistic person knows they are autistic and discloses this to their physical therapist, or maybe this is one of the millions of undiagnosed autistic adults who are out there. So let's consider what this autistic person's physical therapy experience might be like if the physical therapist is thinking through the lens of the medical model of disability when helping their patient. This is our first scenario. There are going to be problems that come up in this scenario, and some have to do with trying to make the person fit quote-unquote reference norms, and the other problems are going to come up because the physical therapist lacks knowledge of the fact that autistic adults exist and can have executive functioning, sensory, or motor accommodation needs in order to access care. Physical therapists also have to remember that if their patient is hypermobile, their patient is more likely to be autistic, and almost all autistic people have motor developmental differences of one kind or another that might affect their ability to perform the exercises you're asking them to do. And so the therapist might have to do some troubleshooting and be creative to accommodate those differences. How can I work with this person to help them discover which movements or positions tend to feel good for their body, which movements or positions tend to feel bad or cause problems? Sometimes autistic movement differences can cause pain or functional limitation, and sometimes they are truly just differences that may look quite different from the quote-unquote reference norm, but actually work just fine for that person and their body. So it takes a lot of teamwork between the patient and the provider in order to teach that out.
I was drawn to people who were different like me. I was drawn to people who needed help. I had the patience and the understanding and the creativity to help other people who were different. So I think that my experiences and my challenges growing up, that led to my desire to be an OT. Be able to do what's meaningful to them. I think that OT is things like going to the grocery store with a person and helping them to manage, the sensory issues that can happen in a grocery store, and then also manage, how to navigate the store, how to figure out what foods to get, how to work through some of those anxieties while you're there.
I see two different kind of populations. I see families and then I see adults. A lot of my adult clients I see on a lesser frequency. I'm not seeing them every week. I'm not working with them to try to rehabilitate some kind of injury that they've had. I'm more seeing them to work on living with their neurotype, understanding why they do certain things, and then sort of slowly working to kind of build daily life routines that work for them. I like to see people as needed. So I don't like to say you need this many therapy sessions with me before you'll have your life back on track. I like to say, you know yourself and I'm here for you when you need me. How often makes sense for you? One of the main focuses of the OT services I provide adults is getting a good idea of what their current community looks like and identifying ways to tap into the autistic or neurodivergent community as they're able to. The way that supports the relationship that I have with clients is honestly that I feel like they know I'm not trying to just keep them coming back to therapy or keep them dependent on me. Even if I'm the first autistic person that you've ever sat down and talked to about your life or your medical history, I don't want that to be the case 6 months from now. We want to have an outlet into the autistic community.
Thanks so much for watching. Be sure to like and subscribe to keep learning from Autistic Voices.